Welcome back to N-Powerment Nursing. I'm Linda and this is Ashley. You've tuned into our series In the Know where we make it simple. And today we are simplifying when there's two right answers.
There's never two right answers. That is the sad news. Here you thought you were going to tune in and we were going to tell you what to do when there's two right answers. Actually, there isn't ever two right answers. These are the questions that are most frustrating to graduates because you can graduate with the most incredible average, with all of the content know-how, but you come to two answers and you can equally defend both of those answers as being correct based on your knowledge. However, there is only one right answer, and that always comes down to a rule around the registration exam, especially the NCLEX, that says when this happens, you would do this instead of this, or you would do this before this. In the real world, let's be honest, you're going to have probably more than one nurse there, and you're going to do those two awesome interventions at the same time, right? You're going to sit up the patient and put on oxygen at the same time while maybe auscultating their lungs, right? But on the registration exam, you have to pick only one of those things to do. So you have to know the rules around which of those things you are going to choose. So we're going to give you some pointers today around, here's some of the rules, kind of give you a little bit of the insight we have into what makes one answer the right answer.
We did a Facebook Live a few weeks ago on prioritization, and you might want to go back and check that out. It was related to who the nurse sees first and what the nurse does first. Today we want to focus on some exam rules to help you select the right answer.
Just so you're aware, in our textbook, we've done all of this work for you. We have all of these rules in this textbook. In terms of the giveaways about when there's two right answer, there's a whole prioritization section that is all of those big dilemma questions, right? Like, no, you're actually going to do this before you're going to do that. We have sections like time specification. So there's rules around how long IV tubing can hang before you have to change it. There's rules around how often you do a dressing change, how often you do this, how often you do that, how often you reposition a patient. There's also strict rules around dietary restrictions in terms of if you have an Addison's patient, which type of diet should that patient have. There's rules around some of my favorite is positioning for safety. So if a patient had a liver biopsy, what position do they go in? If a pregnant woman is having difficulty with whatever, what position do you put them in? So there's a whole list, like 1.5 pages, maybe even 2 pages, about positions for safety. These are things that never change. If this is the situation in the question, this is the correct answer. So now we're going to list 4 pointers for you to help you come to those conclusions on your own. So here we go. Rule number 1, assess always the patient and not the equipment.
And so, for instance, when a change occurs in a patient, like for instance, a pregnant woman, her water breaks, the right answer is always to assess the patient. So you'd auscultate the fetal heart rate and not look at the equipment or the fetal monitor. Also, if you were going to have any kind of respiratory intervention, such as putting in a chest tube or intubating a patient, the best assessment is always to listen to the lung sounds and not their oxygen saturation.
And that's so odd, right? Because you think, oh, I'm going to check their O2 saturation, and I know the O2 normal is between this and 100, but no, it's actually to listen to the lungs. So it comes down to that one rule. Number 2, do something, and you should know what that something is, before calling the doctor unless there's a rule, right?
So for instance, when you have a patient possibly who has their abdominal incision has separated or dehisced, you would place the patient in low Fowler's position at 15 degrees. You'd cover the wound with a sterile dressing, and then you'd call the doctor.
Number 3 is know what position fixes which problem? There are a lot of positioning questions on your registration exam.
So if a patient is short of breath, you would sit them up before placing oxygen on them so that their lungs have expanded.
Right. And the last one, no. Actually, I'm going to cross that out and I'm going to say memorize with a Z. The times you do call the doctor first, because these are very few.
Okay, so the few times would be if a patient has fixed dilated pupils, because that could possibly be a compound skull fracture. If there is stridor, that could be indicating respiratory distress. If the halo test is positive for glucose, because that indicates cerebral spinal fluid, or if a patient experiences pain after cardiac catheterization, that could be a complication, possibly a hematoma.
So the good news is that we've done all of this work for you and you don't have to guess. We've listed all of these principles within our textbook. But if you don't join us in your complete study process, that's okay. We hope this has helped you, knowing that you always assess the patient. You never look at the equipment. You're always going to go to the patient prior to the equipment. You're almost always going to do something or assess something before phoning the physician. You should know which position fixes which problem and what position you will put what patient in. And you also need to memorize the few times that you actually phone the doctor, which is almost never. So you can memorize those very few times when you know there's nothing I can do at this point. There's no assessment, no intervention. I need to phone the physician immediately.
For more in the know and for all concepts simplified for your registration exam, check out our complete study package. See you next time on In the Know.
Bye for now.
Bye for now.